No medicine can remove the cause of a lifestyle disease, but you can. Welcome to Lifestyle Disease Doctor. In this third part of the four-part series on heart disease, we look at the various complications associated with heart disease and also the associated other health problems that are commonly found along with heart disease. We have Dr. Jolly who will be answering our first question on what are the common comorbidities associated with heart disease?
Most common comorbidities, one is hypertension, diabetes, and dyslipidemia. Dyslipidemia means high triglyceride and cholesterol. And usually these patients will be having fatty liver also. And many of them will be having that fatty liver means chronic liver disease. And also they'll be having chronic kidney disease also, because the blood vessels of the kidney also will be affected because of the diabetes and hypertension. And maybe many of them will be having some skin manifestations. If it is diabetic, they'll be having some diabetic dermopathy, or even the darkening. It's very common that these heart patients having darkening at the forehead, cheek, or around the diabetic patients because of the hyperinsulinemia, the darkening around the neck and skin manifestations. And many of them will be having gastric problems because they are eating so many medicines. It's blood thinners like aspirin, clopidogrel, all will be having so much of acidity. It can create gastric ulcers. They'll be having acidity and problem, and so many will be problems will be there.
Actually, since you mentioned that diabetes is very commonly associated, and similarly fatty liver and liver associated conditions. So, how does diabetes and fatty liver or liver disease affect heart disease, or does it create any conditions for heart disease?
See, it's all a part of metabolic syndrome, actually. So, obesity, hypertension, diabetes, dyslipidemia. And along with that, this fat is in excess in the body. Because why? We are eating more than what we want. And if it is excess food, especially the calorie is only for energy usage. Nowadays we are living in a sedentary life. We are only applying some computer work, or everything is mechanized. So energy is need is less, but the all the food which is tasty or the traditional food, the major part is this calorie, either in the form of carbohydrate or in the form of oil. And we are using more fried things and oily things, and all the toppings with this saturated, and that fat itself what we are using is very unhealthy fat, like a hydrogenated fat. Our body doesn't know how to handle the hydrogenated fat because not it is a natural thing. This artificial ghee actually. So all our preparations are laden with that, and that is, this fat is excess in our body, and the fat is our body genetically doesn't know how to manage this fat because it is hydrogenated fat. And trans fat, even it is well, there is not much of the now there is regulations about the trans fat and all, but even it is not saturated fat, but the hydrogenated saturated fat also is a problem for our body to handle. So it will be deposited in our body, and what will happen with it when excess fat is there? There is no place for the fat to go, so it will be deposited. The liver cells itself is laden with fat, that is called a fatty liver. And the blood, there is no blood is also a tissue, like actually it is a flowing tissue. The blood is a flowing tissue actually. So where is there's no place for the deposit. It will be, the blood will be accumulated with, so that is why I had seen patients with 1500 triglyceride level. So this cannot be reduced with the statin. If you don't take the statin also, the triglyceride level will not be reduced. You have to reduce your intake of fat and carbohydrate. Carbohydrate that is digested to glucose. So excess carbohydrate intake is the reason for your high glucose. The high glucose is called diabetes. If you reduce the carbohydrate intake, your diabetes will go. So instead of that, simple logic and simple measures, we are depending on the medicines. What this diabetic medicine is doing? Actually, diabetic medicine, if you are injecting insulin, there is no deficiency of insulin in type 2 diabetes. 90% of the patients with diabetes is type 2 diabetes. The insulin level, when you are injecting insulin, you are inducing hyperinsulinemia. And insulin, when it is increased, it will retain sodium. Sodium retention will be there. The first line of treatment for the the hypertension is reducing the salt intake. But the opposite is doing by the insulin. And also, most of the medications used for the diabetes also is actually increasing the insulin secretion from the pancreas. So, pushing the pancreas to produce more insulin. So, what will happen? The insulin level is very high, and the maximum higher normal insulin level is 25, around 25. Actually, the body needs only, if you are eating properly, only 4 or 5 units of insulin testing will be that much is enough. But I have seen patients with more than 300 insulin level. Those who are on twice or thrice, they are taking insulin injection also. So anything is in excess is harmful for the body. So we know that thyroid hormone, if it is increasing, it is very harmful for the body. Just like that, insulin, it is increasing also is very harmful for the body. Actually, because all the insulin, we discovered insulin 100 years back. At that time, we were not knowing all these mechanisms. And the type 1 diabetic patient, it's a boon actually. And diabetic and insulin is very useful. But we are using it for the type 2 diabetes also. There, it is actually harming the patient. And previously, we never had this testing for the insulin test and C-peptide test and all. It's not available. But now it is available. But the medical education and the medical system or the it is not integrating. It is not yet integrated these things into the medical practice. Actually, that is the problem. So we are in many places we are going against the science. If there is excess insulin is there in the body, then why you are injecting insulin? So many patients also doesn't know that many patients thinks that there is an insulin deficiency. That's why I'm taking insulin injection. So it is not correct. If you are able to correct your diet, control your carbohydrate intake, you can come out of it very easily.
Generally, a commonly felt feeling is that controlling blood pressure is very important for your heart health and preventing heart disease. But at the same time, it is also heard that many medications taken for blood pressure actually affect the diabetic patients because their sugar control is disturbed and affected. And also, many of these BP medications create fatigue. So, fatigue means you feel uncomfortable and find some sort of exaggerated eating and all takes place. So, what is the way forward for patients who have to control their BP, but their medications can affect their diabetes or general feeling of exhaustion and fatigue and all that?
See, final solution is lifestyle correction. But a person who is on medication, especially heart patient or diabetic patients on too many medicine, if they're taking only the first line of medicine like metformin alone, they'll be able to do the self correction. And when their blood sugar is normal, HbA1c is come down to normal, they can come out of. There are so many patients coming out of medication like that. I had seen many because after seeing the videos and they are understanding that how to control this thing. And if with only one or two medicine, only one disease, only diabetes or only hypertension, only dyslipidemia, then they can come out of it with the self lifestyle correction. And the patients also should be, those who are trying for that also, they should be having reasonable knowledge and reasonable capacity to monitor also. But if you are on medication, on the heart patient, on so many medications, they actually undergo a clinical with this medication withdrawal and all should be done with the clinical support. And in my way of clinically supported lifestyle correction, we are actually giving the optimal nutrition, optimal exercise, and reduce the toxin going into the body. These patients who's having diabetes and hypertension, I'm seeing many patients will be using 3-4 medication for hypertension a very high dose of statin and maybe some other fibrin. Some other medication also is there for reducing the triglyceride and all. They will be taking that too. And also insulin and 3-4 diabetic medication. And they'll be having fatty liver and so many other problems, and definitely gastric problem, gas and acidity and discomfort will be there because they are taking so many medicines. So in my experience, when we are doing with clear roadmap and clear protocol, we are able to come out of almost all the medicines within a month itself. For this, especially for those who are taking this metabolic syndrome type medication. Only thing we are not able to, if the patient has put a stent, they have to use the blood thinners for a year. And also those who have put this pacemaker. The pacemaker, we cannot take it back because the pacemaker may be applied on the chest, but the leads are going into the heart. This wires will be wired to the heart. So in that patient, once this pacemaker put, you cannot take it back, and they have to use the blood thinners lifelong. Other medications, in my experience, all these cardiac patients, it's metabolic syndrome people, you can come out of medication, most of this within a month itself. That is the beauty of it. You can, if you are putting a stent or going for the bypass, again you have to take the medication for lifelong. And even if you put the stent or put the bypass surgery, then again you the chance of getting second attack is not reduced. That is showing the study. I'm not that is not from the study. I'm saying from my experience, it is a study shows that. And most of the patients is one of colleague, friend was telling. It's a very close person was telling. Doctor, I had one stent 5 years back. Now last month I had put one more stent, and doctor said you are safe for another 10 years. He's already 68 or something. So that people are thinking like that. That is, doctor is giving just to make them confident. It is not the truth. So many things it is to instill confidence in the patient and reduce the fear and all. But stent or bypass surgery will not. That is, the studies, long-term studies shows that stent or bypass surgeries will not reduce the chance for a second attack. The three modern medicine measures we are taking is, one is the medication, that is the next is the stenting, and the third is the bypass surgery. All these three, the long-term study shows that doesn't mean they give any difference actually with the three, and no one is giving any structured study for the lifestyle correction. That is the problem. All over the world, there is not much of these studies, but in Western countries and America and all, there are doctors who is focusing on the heart patients. The cardiologist itself focusing on lifestyle correction. And what my experience is that this is not the. They are also not saying that you can reduce the diabetic medication and all. Actually, it's a single solution if it all comes under the lifestyle disease. That every patient should understand that these medications chronically, if you're taking, it is a lifestyle disease. And if you are willing for the lifestyle correction with the proper understanding, then you can come out of it. That is, I'm talking from my experience, not from the net or from the medical books. There will not be anything like this, what I'm telling in the medical books or in the so-called medical literature. But it is with the evidence-based, basically the following up the patient with meticulous follow-up. This cardiologist is not following usually not following the HSCRP or the other cardiac markers. But here we are following the cardiac markers meticulously, and then reducing the medication and following it with even the CIMT test and the cardiac, even the patients with the reduced ejection fraction, that is actually cardiac failure patients with a massive heart attack. Their cardiac capacity, the pumping will be reduced. Even the patients with reduced pumping also, they can regain the cardiac pumping capacity also, reduced to 30%, 20%, such things also. After 3 months, it will be increasing. The patient's pumping capacity also is increasing. Everything is doing on the evidence-based actually.
You often say that, a fatty liver is something like a beginning of or way towards heart disease, but people generally ignore it. what is it that patients who first understand or think that they have fatty liver, what should they know about the future possibilities of developing heart disease?
The fatty liver should, if it is usually in the stage 1, that is a progression. Stage 1, stage 2, stage 3, and then fibrosis, cirrhosis, and liver failure or liver carcinoma. That is the progression of the fatty liver. But we should understand that along with the fatty liver, there will be, it is that what is fatty liver? It is excess fat in the liver. When there is excess fat in the liver, there will be definitely the triglyceride. If you're taking the statin, the cholesterol will be reduced, but your triglyceride level will be in excess. And that will there is no place in the body, the adipose tissues are full. They say, no, I don't want anything. I don't want more fat. So there's no place for the fat to go. That is why it is accumulated in the production site itself. That is the liver. It is not the production site or the if you are taking excess carbohydrate, that is if you are taking too much of rice or wheat or sweets, then it is converted into glucose inside your tummy, and it will be absorbed into the liver. Absorbed in the bloodstream and directly come to the liver. And liver excess fatty carbohydrate glucose is there. Liver has to transform it into fat. Liver, when there is excess fat in the liver itself, how can liver transform it into, so the fat will be circulating inside your blood and there's no place to deposit, so it is deposited inside your blood vessel itself. It is actually creating the block inside your coronary artery, and when it is blocking your deposited in your renal arteries, you will be starting getting BP will be increasing. And also this even though the sugar is okay, this type 2 diabetic patients, usually if the pancreas have the capacity to produce more and more insulin, the diabetes will not come. The excess carbohydrate, the glucose will be converted into fat, again fat, and the diabetes will come only the end stage if the pancreas is very active. You will be putting on weight, more and more weight gain, and obesity will be there. And then finally, this all is deposited in this, and you are nearing to a heart attack and the renal failure and the problems. And even the medication also will be affecting the kidney and the liver. So many medicines and the fatty liver. Actually, you're damaging. Basically, this all is because of the food. Excess food you are taking, especially the calorie, you are damaging your liver, the blood vessels, liver, kidney, brain. Brain will be get damaged when the brain blood vessels is affected. The brain will be your cognitive function will be reduced. The heart will be reduced. So that is it's a progression of the metabolic syndrome actually.
Also, you have mentioned about how important it is for understanding gut health of the patient also with respect to heart disease. And what exactly should patients know about their gut health?
See, basically, not only the gut, even the oral health also is very important. If you have tooth problems or this plaques formation, periodontitis, so that there will be bacterial growth will be there. And if you are diabetic, definitely that blood sugar and all is high. Actually, this even from the mouth, this dental hygiene to intestine, gut, everything is actually related. That we should understand that. If you are getting caries or dental problems, you should check for the heart also. The problems like HSCRP, and there are now tests available like high sensitivity troponin level, many cardiac markers are there. The first cardiac marker is lipid profile. If the cholesterol and triglyceride and all is very high, especially the SDL level. Actually, the most important, the lipid profile itself, most important is triglyceride and HDL. If it is HDL and triglyceride normal, even if the cholesterol level is, total cholesterol is slightly high, you don't have too much worry about it, provided your glucose level, SbA1c and all is normal. So basically, we should understand that all these lifestyle diseases are acting together. And when you are on the medications for the diabetes, hypertension, heart disease, especially this aspirin and clopidogrel, this blood thinners, that will increase the secretion of the acid secretion inside the stomach and it will produce acidity. And all these medicines are harmful for the intestine, mucosa, that is the covering, that is lining of the intestine, and also the uh, microbes staying inside the intestine. So there are so many friendly microbial organisms inside the intestine. They'll also find it difficult to survive there because of this medication. So it is not ideal for them. So we should. That is the importance of reducing medication, and we should go into, because the last 50 years we are making too much of medications and eating too many medicine, more and more medication. Actually, even if it is more than 2 or 3 medicine, we don't know how to these medicines act. They are all interacting. You are focused taking the medicine for diabetes. It is not going to the pancreas or alone. It is going to all the cells in our body, because there is no discretion. There is some very minor discretion only. Even all these medicines getting into there is a protective mechanism in the brain not to get all these toxins inside the brain. That is, blood-brain barrier is there. But most of these medicines we are using for this lifestyle disease, like diabetes, hypertension, and all is going to the brain also. That is the problem, because for this getting this irritability, cognitive imbalance, and so many problems are there with almost all the cardiac patients and diabetic and hypertension patients. They will be getting irritable and anger and irritability, depression, and many psychological problems also will be associated with this disease and also with this medication. This is actually, it's both is going together.
As you talked about medication, another aspect that we hear is, if sleep is not good, it can affect heart disease in a bad way. At the same time, we understand that as far as medications are concerned, many of these patients may be taking many medications at the same time, and many of the medications may actually affect their quality of sleep. So, in such conditions, what should patients understand?
See, all these patients will be taking a handful of medication at the night also. They are eating the medicine and going to sleep. And this, I'm seeing patients with 3 antihypertensive medication also they're taking at night as a night dose also. And diabetic medicines will be there, and one shot of insulin will be there, and aspirin. See, when you are eating all these medicines, how can you sleep properly? Because it is all making discomfort for you. So naturally, the sleep will be disturbed. And also, most of these patients will be obese, overweight, and the snoring will be there. And the sleep apnea will be, many will be depending on the CPAP machines. I've seen so many patients who are using, nowadays the number of patients who are using CPAP machine to sleep is also increasing. Even the sleep up also putting all this mask and all in the face, it will be that also making them uncomfortable. So this, even the snoring also is a problem. Actually, because of the snoring, this continuous irritation, it will be creating on this carotid arteries, which is supplying the brain. So the chance of a stroke is very high for these patients with the snoring problem. And those patients with the snoring and also those patients with the heart problems, they should all look for a CIMT test, that is to see what is the situation of this. That is the biggest vessel which is so superficial. So we can do the test which is directly seeing with an ultrasound machine is this carotid artery. And carotid artery plaque development and fat deposit is given example for the health of the whole blood vessel in the body. So the people who are interested in the cardiac health and the brain health and all, look for these markers. There are so many tests available now. I think in India it is very easy for us to do all these tests, but in Western countries I get patients from different part of the world. Like I found it, and I understand that it's most difficult in the US to do a test, because they have a certain protocol for the insurance is deciding everything. So they can do even the cholesterol test only once in a while. They're actually worrying. Many patients who are coming down for the treatment here and going back find it difficult to what will we do with the test actually. So I always ask them to stay here for at least a month, and if preferably, if they can possible return and all, they can stay for 3 months. Otherwise, at least for a month, and come out of all medications and their cholesterol, everything stabilize, and then go. And if everyone can check the blood pressure and blood sugar at home. So if the blood pressure and blood sugar is controlled, and they are reducing their body composition, they can check the weight also, like weight and the abdominal circumference. So that is two important measures which we can, without any difficulty, we can do. So we can check it, and we can follow it up over the telemedicine. We are following it up the patient. But if in India, we are very free to do the test, and it is very economical, the tests are here. So it is very easy to manage when the patient is at India.
In clinically supported lifestyle correction, what is the possibility for those who may be staying alone or something like that? And also, what is in general the support that they should be given from their immediate family if they want to do it successfully?
See, if they are staying alone, there's no problem. If a patient is staying alone and taking insulin injection, which is the most dangerous thing one can do, because insulin is really a dangerous medicine. And if they get an vomiting or a stomach upset and they've taken a shot of insulin and they vomit all the food out, they can go in and they're staying alone and no support is there. They can go into hypoglycemia itself. And also, when you are sick, it is when you are living alone, it is always better to come out of all the medicines, and all the medicines can create problem for you. So coming out of medicine is the most important thing. But you cannot simply come out of medicine. You need support. So you have to get to clinical support and come out of the medications and stay. Especially diabetic patients, the most dangerous medicine is actually to living alone is a diabetic medicine. Hypoglycemia is the problem. And also, if you are taking antihypertensive medicine, and then if you are getting up at the night, and you can get because you can get a hypoglycemic hypotension when you are going into the toilet, and you may lose your balance, and you get giddiness and you can fall down. And there's no support in the usually the patients. We always hear that the bathroom fainted in the bathroom. It is because of this high. When you are getting up, when you are on medication for the pressure, hypertension, we are getting up the body, especially from the sleep, body find it difficult to adjust the increase the pressure. Your pressure will be very low, especially you are sleeping, and finding it, the body will find it difficult, and you get a the brain will not get enough circulation, so you will get a blackout and you may fall. And if you know elderly person, they can get a fracture, and that will be very difficult to manage also. So basically, if you are staying alone, you see that you are healthy and you are out of medication for the lifestyle disease, the corrected lifestyle disease, and you get a support for nutrient and food, so it will be easy for you to manage yourself. And you may be taking 3 times, either you will be preparing food by yourself or getting food from outside food you are taking, and you are staying alone. But you will be getting support food, so you can minimize the effort in the kitchen or outside food. Definitely, it will not be healthy. So that is it. It is very easy. But what I am finding it most difficult for the patient is the family support will not be there. The patient will be understanding what is this, what is clinical. They will be researching on it and seeing hours of videos. Then only they will be deciding. And today also one patient was telling me that doctor, I am following you for a long time, more than for 5 years. And there are patients at least 1 year they will be following, or they are when they are facing and then they're searching and they're seeing the videos, and they'll go into the deep in depth and studying and come. But if the patient who's especially 60-year-old, 65-year-old, their children will be also making a part in the decision making. So they'll be discouraging, and because they don't know what it is, they're not interested. That it is parents' problem, but some children are actually the children will be studying it and then directing the patient. Then it will be easy. But when the patient is understanding about this clinically supported lifestyle correction, and when the children or the wife is not supporting, and they're not willing to look into that, and then give they're usually they're point blank they'll be blocking. especially that children are doctors. That is what I am saying. But all the medical professionals, like nursing or the pharmacy, they will be usually willing to accept. But generally, doctors are against such this lifestyle correction and all. Generally, it is unscientific. Actually, this is the most scientific thing we can have. And the most scientific thing, we are taking it unscientific. Actually, the other things are, many of the medical line of management is unscientific with the modern understanding. This all started years back, 20, 30 years, this bypass surgery and all started almost 40 years back. And that time we were not knowing that the understanding about the life science and the health sciences increased a lot now. So that understanding, even the medical fraternity and medical curriculum is really not updated according to the life science and the health science improvement.
With that, we come to the end of episode 3, wherein we looked at the complications associated with heart disease and also the associated other diseases that are found commonly along with heart disease. In the next and final episode, we will be looking at how lifestyle correction, which is clinically supported, can help support and reverse heart disease, and what patients should know about correcting their lifestyle when it comes to treating heart disease. Thank you. The informed patient is key to treatment success.